focus on, I'm just gonna read and she's gonna do.
Okay.
So we got sub-Q first.
We can do something.
I just was going in order on your
No,
paper.
do it for me.
You may-
So with your injection medication administration, remember all these are on your, under what, skills administration? These step by step that we're going through. First, you're gonna do hand hygiene and put on clean gloves. Oh, sorry.
It's alright. Got it.
So with this, we're gonna do a subcutaneous injection. You could do that outer aspect of the upper arm, the anterior thigh, or the abdomen. 2
Your
inches.
abdomen location has to be 2 inches away from this umbilicus or your belly button.
So remember that for your sub-Q, it's belly, thigh, or bye-bye, like you're waving. Think about what's wiggling there. So for your sub-Q, you would just look at your order, see what it says. We're gonna do umbilicus first, or abdomen. Clean the site with an alcohol pad. That one, okay. Start in the center and clean outward in a circular motion. Allow it to dry, in which you can verbalize that, and then you can mark it with that alcohol swab if you want to. Use that corner to mark your spot. Pinch up the subcutaneous tissue, but don't contaminate your clean skin. Remove the cap from the correct needle and insert needle quickly at a 90-degree angle. Unless it's a pediatric patient or somebody that's very, very thin, then you can use that 45-degree angle. Inject slowly at an even rate. Let go of the pinched skin and remove your needle. This is important to say, is discard that needle into a sharps container.
And then here is your sub-Q with insulin. So I did a regular sub-Q, and this is your insulin, smaller needle, same concept, pinch, go, let go, pull out.
And discard in your sharps container. Remove gloves and wash hands. Okay, you ready to move on to the IM, the intramuscular?
Sure.
Alright, so again, same thing, hand hygiene, put on clean gloves. You have 3 sites that you can do for your IM injections, the ventrogluteal, the vastus lateralis, or the deltoid. So to find the ventrogluteal, put your palm on the greater trochanter with the middle finger pointing toward the iliac crest, and index finger pointing toward the anterior superior iliac spine to form a V. So when you're showing us this on your video, on your person, you're going to say those landmarks. The greater trochanter, the iliac spine, and the anterior superior iliac spine, or the iliac crest, I'm sorry. And in between that V, in between your knuckles is where is where the ventrogluteal muscle is, where you're gonna do your injection.
So an easy way to remember that, your greater trochanter is like your hip bone that you feel over there. Hip bone, greater trochanter. Your spine is an up and down portion, so your middle finger should go with your spine, up and down. Then that iliac crest, if you think of a crest curves, so your index finger should follow the curve. Then in between that is where we go. Your alcohol, same concept, in to out. And you can leave your alcohol pad to where the little corner of it points to where we're going, if that makes sense.
Make sure you select your IM needle. Insert at a 90-degree angle. Stabilize with your thumb and index finger or the non-dominant hand. Insert medication slowly. Remove the non-dominant hand and withdraw quickly. Discard into the sharps, put on a Band-Aid if needed, and wash your hands. Next is the vastus lateralis. The palm of one hand is on the greater trochanter again. Palm of the other hand is directly above the knee area. You're going to connect at the thumbs to form a W. The injection site is located in the center of the W where the thumbs meet. Clean your site, allow it to dry, mark it.
So if you want to say the point of your alcohol is in the point of your W. Thank you. Okay, ready.
Insert at a 90-degree angle, stabilize with your non-dominant hand.
Ooh, mannequin is not pliable right there.
They got some tough skin.
Oh,
Of course, there's no telling how many times that needle's been used either.
let's see if we can use this side. No. Alright, whatever. Alright. X marks the spot. Golly.
Stabilize with your non-dominant hand, insert the medicine, and then withdraw quickly. You can cover it with a Band-Aid and then wash your hands. And then the last one for the intramuscular is the deltoid. Locate the acromion process. Kind of like that knot up there in your upper arm. Place 3 fingers below it. Make a V with the other hand. Under the 3 fingers, it forms another V. Injection site is right in the center of that triangle. Then clean it, let it dry. Be still, mannequin.
I know. Work with me. Alright, so V. Circle was my alcohol wipe. 90-degree angle, straight in, straight out. A student before told us that how they find the acromion process is follow your armpit all the way around. You should find at that process, then make your V down.
And then the last is the intradermal. Hand hygiene, don clean gloves. Locate your correct site, which is the inner forearm. You can use the scapular region of the upper chest, but we're going to use the forearm. Make sure the area is smooth, clean, free of tattoos, abrasion, hair, burns, any kind of scars. Clean the site with an alcohol pad. You're going to start at the top and wipe downward 3 times. Allow the site to dry, but mark with the alcohol pad or keep eyes on the site. Pull skin taut with that non-dominant hand. Hold in place. Be careful not to contaminate the skin in the center that you've already cleaned. Remove the cap from the correct needle and insert slowly at a 15-degree angle with the bevel facing up.
So that's the eye of your needle. You should be able to see it, and it goes up. 15-degree angle.
Inject the medicine slowly at an even rate of speed because you're going to form that bleb or that bubble underneath the skin. Remove the non-dominant hand, carefully withdraw the needle straight back, discard your needle into a sharps container. If it bleeds, you need to wipe away some blood, you use your alcohol pad, what's called wick away, but you don't want to wipe it Don't put any pressure or Band-Aid on it. Remove gloves and wash hands.
For the intradermal, you guys can use your hot dogs if you want to,
It will make a nice little bleb.
and inject water, and you should have a nice little bleb that pops up at you.
Another thing is that it's under your skills. You have that injection PowerPoint, those slides. There's so much information on that about this. This is just the performance of your procedures, but all the rest of that information is on those slides. Thank you. Be safe.